The UNDP has estimated that nearly 6.2% of Pakistanis have some form of disability. Other estimates consider this proportion to be much higher. The HRW, for instance, has pointed out how estimates of PWDs in Pakistan vary widely, ranging from 3.3 million to 27 million. There are many disabled people in our society. Their disability is due to various reasons like, disability due to lack of medical treatment, disability due to accident, war conflict and disability due to old age or any other reason. They go through very difficult situations in the society. And moreover, when they belong to the poor class, these difficulties and sufferings are doubled. Unfortunately, we have this negative mentality that people with disabilities are considered inferior and are cut off from society due to their limited knowledge and lack of understanding of the environment due to their disability. Some people are born with disabilities who cannot understand the importance of the environment and objects, so there is a negative attitude towards them in the society. Negative attitudes have also been observed in households where persons with disabilities are present and considered to be an economic and social burden. Due to this socially stigmatized attitude, access to education for disabled people is severely limited. Their disability creates the perception that they do not need any kind of education or that they cannot benefit from education. Education should not be given. The result of this attitude is that the abilities of persons with disabilities are adversely affected and the opportunities through which they can participate in discussions for their rights are also restricted. Among the disabled people, men are facing problems, but the most problems are for women who are suffering from disabilities. In rural areas, women especially playing a big role, for example, managing the house, fetching water, fetching firewood for fuel, taking care of livestock and cooking food. But when a disabled girl is unable to do all these things, she is considered an outcast from the community and restricted at home and responsibility of care is given. Therefore, domestic work is taken from her and she is not considered worthy of educational and other activities. Generally, girls are married and sent away from home, but disabled girls are kept at home. They are kept and they are used. Currently, where physically disabled people suffer from the negative attitudes of the society and are lonely in social life, there are other difficulties for them in their daily life as well as one of the most important difficulties for them is absence of proper sanitation. Since water and sanitation systems are closely related to health, if the water is contaminated, it will spread various diseases. You can see, where millions of people are suffering from diseases due to drinking contaminated water due to contamination of clean water sources and reservoirs due to inadequate sanitation system. If the sanitation system is improved, it will improve health. Inadequate sanitation systems are particularly harmful to people with physical or other disabilities and are more susceptible to disease than others, and proper health precautions become difficult for them. If properly designed for the physically challenged, if there is no latrine, they can get germs and get sick very quickly. For example, disabled people who are disabled with legs and walk on their hands on the ground, their hands can get infected with germs. And if they don't clean their hands in time, they can suffer from fatal diseases. It is impossible for disabled people who have limited access to water to keep their hands clean all the time. Can be stressful for people with disabilities. Although many people with disabilities cope with their disabilities with the strength of other parts of the body, collecting water and cleaning dirt can add more stress to those parts of the body. Ability to work in the future may be affected. Sometimes it is also seen that disabled people are sent to defecate or urinate in the open. Open defecation should be stopped as it poses risks to the entire community. It is the responsibility of all persons to have proper provision of drinking water and sanitation for disabled, because if persons with disabilities use open spaces, it creates water and environment pollution. It has been observed that public facilities, such as schools, hospitals and government institutions and offices for persons with disabilities, especially lack sanitation and water facilities, which directly affect their opportunities to move forward in life. For example, children, especially girls, are prevented from going to schools simply because there are no latrines, and also places where a small number of disabled adults work. Lack of adequate latrine facility is the biggest hindrance to the working of disabled persons, which renders them unable to work continuously, thereby depriving them of a source of livelihood. Latrines constructed in most government offices and public places are not suitable for disabled persons. Such latrines are designed for physically healthy persons. It is the responsibility of the Ministry of Health to issue guidelines in this regard. That all offices should have properly designed latrine facilities for disabled persons so that if physically disabled persons work in the offices, if proper sanitation is arranged, disabled people can secure their self-esteem in social life as well as their own. So instead of being a burden to someone by getting a job, they can stand on their own feet. Thanks for watching. Please like, subscribe, and share. Kokub Helping Home.